A spill of blood or other potentially infectious materials must be cleaned up promptly and properly. To protect yourself and others, follow these steps. First, block access to the area to prevent others from potential exposure. Next, gather your cleaning supplies. Use the supplies specified in your employer's exposure control plan. This might include disposable tongs, disposable absorbent towels, a solidifier, disposable scoop and scraper, a biohazard bag, a biohazard sharps container, and 10% bleach water disinfectant solution. Then, put on the appropriate personal protective equipment according to your employer's exposure plan. You should always wear disposable non-latex gloves when coming into contact with blood or other potentially infectious materials. You might also need a gown, shoe covers, eyewear, a mask, or a face shield. Before cleaning up the spill, remove any sharp objects using tongs or a disposable scoop and scraper. Never use your hands. Remember to dispose of the sharp object in a biohazard sharps container. Wipe up the spill using disposable absorbent towels. Dispose of the towels in a biohazard bag. If available, you can also use a solidifier to absorb a spill. Just pour the powder onto the spill and scoop up the mix. Dispose of soiled materials in a biohazard container. Put on clean gloves. When using a bleach solution, always wear gloves and eye protection and ensure good ventilation. Then, flood the area with the disinfectant solution. Also, be sure to let the bleach solution stand on the surface for at least 10 minutes. Finally, use clean absorbent materials to wipe up the disinfectant solution and dry the area. Dispose of all soiled materials, including your personal protective equipment, in a biohazard bag.